Bernie, and I'm going to be doing my meter dose inhaler competency. So today, before entering the patient's room, I would check the patient's medical records to see if any of that would help with the assessment today, and if there's any information that I would need to know prior to entering the room. Also, I would check for any PPE requirements, which there are none, and also the physician's orders for what I will be doing today. So what the physician ordered is a assessment if the patient needs an albuterol administered to her. So prior to entering the room, I would also gather my materials, but first I would sanitize my hands with 3 ml of hand sanitizer, rubbing my hands for 15 seconds. And then I would need my stethoscope, pulse ox, meter dose inhaler, some alcohol pads, calculator for my calculations, pencil, a blank piece of paper to record any findings, a napkin for my patient to cough, the peak flow meter, and a spacer or chamber. Also a set of gloves and some hand sanitizer. So I'll start by sanitizing my stethoscope. Sanitize the bell and the ear pads or earbuds. And the pulse ox. And then placing this in my pocket, and then sanitizing my hands again with at least 3 ml for 15 seconds, and then we'll enter into the patient's room. Hello, my name is Bernie. I'm from the respiratory department. May I get your name and date of birth, please?
Jocelyn Buzz, 10/29/1990.
Okay. And from here, I would double check that her band does match the name that she gave me and her date of birth. And then also at this time, I would scan the room, making sure that there's no hazards. And if the patient had any family members here present, which today she doesn't, but if she did, I would ask them if she would like them to be escorted out to give the patient some privacy. So today I will be doing a little respiratory assessment. I will need to gather some vitals, listen to your lungs, and to see if you need an albuterol administered to you to help with your breathing. Because I know in your medical records it does mention that you do have a little bit of asthma. Okay, sounds good?
Mm-hmm.
Okay, so at this point I would sanitize my hands once again with 3 ml at least. And then putting on the gloves. So we're going to start with vitals. I'm going to take your pulse, your respiratory rate, and then your O2 saturation, okay? So I'll start by placing the pulse ox onto your finger, making sure that it's on. Okay, I'll check your pulse. I'm going to move your watch a little bit. Okay. And I would do this for 30 seconds for the pulse, and then 30 seconds for the respiration rate. But when I do the respiration rate, I would not let the patient know, just so that they don't change their breathing. Okay, so for the pulse, I got 44 for the 30 seconds. I'm going to multiply that by 2, and it gives us the 88 for her pulse. And respiration. I'm going to double check your pulse one more time, okay? Okay, so for her respiration, I did get 7. For the 30 seconds, I would multiply that by 2 again for the full minute, and I would get 14. Her O2 is at 99 on her pulse ox. And then, are you having any trouble breathing at the moment? No? On a scale of 1 to 10, 10 being that you can't breathe, and then 0 that you can't breathe, where do you feel like you are?
0.
0? Okay, so this one is 0. And I'm also going to assess her skin, making sure that there's no sign of cyanosis. So I'm going to grab it real quick. So she is cool to touch, warm with a good tone, and I do not see any cyanosis in her digits. So no cyanosis. So from here, I'm gonna also take a listen to your lungs. Is that okay today? Okay, so I'm gonna do approximately 8 or more. I'm gonna hit 8 or more spots on your back to listen to your lungs, 2 on each side, and then 8 or more on the front as well, and then 1 by the neck. Okay? And then if at any time you feel lightheaded or you need a break, just let me know and we could do so, okay?
Okay.
Sounds good. Okay, I'm gonna start in the back at the bottom. Okay, go ahead and take a deep breath in. Okay. Again. 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 And again. 2 more. 1 more. And then again. Okay. So I'm going to go on your sides now, starting from the bottom and going to the other side. Okay? Go ahead. And again. Okay. And again. And again. Okay. How are you feeling?
Okay.
Good?
Yeah.
No lightheadedness or anything?
Not really.
No? Okay. So now I'm going to do the front. Again, like I said, 8 or more spots I'm going to hit in the front, okay? And then on your neck. Okay? Okay. Go ahead. Go ahead. Again. Again. Okay. Now 1 more up here. Go ahead. And then on this side as well. Okay. Still doing okay?
Yeah.
Okay. 1 more. Go ahead. Okay. So after listening to your lungs, I did hear a little bit of wheezing, so you will be getting some albuterol through a metered dose inhaler. And I also checked your neck for any stridor, which is clear. Okay, so just some albuterol today. But prior to getting the albuterol, we're gonna do some little breathing measurements with your peak flow meter. So your goal is to reach 390. So what we're gonna do is gonna take a deep breath in and then blow out, surrounding your mouth with your teeth on the mouthpiece and blowing out like you're blowing out candles, okay?
Okay.
So we're gonna do that 3 times to measure your breathing. Okay, whenever you're ready. Okay, so for this one we got 250. Okay, or 2 more actually, whenever you're ready. Got 255 again, and then your last try. There you go. Okay, and we got 255 again. Okay, and your goal was at 390. And then reset this for next time. Okay, so I'm gonna do some math. I'm gonna put the best, so which is the 255 over the predicted, so 390 times 100. I'm gonna do that math real quick. 390 times 100. Okay, so 65% is what your lungs are working at right now. So you would benefit from some albuterol. Also about albuterol, some side effects that you may get from it are increased heart rate, some tremors, and also some dry mouth. Is that okay?
Mhm.
Yeah, okay. And then if for any reason the side effects get too much for you, just let us know. But I will monitor you upon administering this, okay? Okay, so when using the dose inhaler, meter dose inhaler I mean, this is your canister of albuterol. We'll put this in our hand for now to warm it up. And then this is your actuator to help deliver the medication and your cap. And then we also have your spacer or chamber, which is this. It is a one-way valve, so it only works when you inhale in. If you inhale too hard, then there will be a little musical note that will play. So when using this, we would just attach the inhaler and then I'll show you everything else about it. So when assembling the meter dose inhaler, since this is going to be your first time using it, we want to warm it and prime it. So to prime, we just attach, we shake it a little bit, and then spray it away from us at least once, like that. Okay, so that's how you prime it. And then to use, we just attach it to the back part of here. Fits like a glove, and then we would then tilt our head back like this, hold the spacer up to our mouths, and then coordinate the press with the inhale in. That is slow but deep and smooth. And we want to hold that inhale for at least 4 to 10 seconds, 10 being the best. And then when we want to exhale, we'll exhale through our nose. You think you should show me?
Yeah.
Okay, sounds good. I know it's a lot of information. So let me go ahead and remove this for you. Okay, so we're going to start with you explaining priming.
Okay, priming. I'm gonna shake it up and warm it up, and then spray it,
Mm-hmm.
and then put it back on the spacer, and then I'll make sure my head's tilt back, and then make sure I coordinate the pressing of this with my inhalation. Okay, so I'm gonna exhale first, and then
And hold for 10 seconds at least. Okay, awesome. And the reason why we have you exhale through the nose is so that if you exhale through the mouth, you're going to release all that extra medication that's in your lungs and it'll just come back out. So it sounds good. And the reason why we use this is so that it's for better deposition of the medication to actually get into your lungs and stay there rather than it hitting your teeth or the back of your throat causing dryness or irritation. Okay, you have any questions so far about this? Awesome. Okay, now to see if the medication worked, we are going to get some reading or values from your peak flow meter as well again. Just go ahead and close this. So we are going to do your 3 attempts again, trying to get to the 390. Okay, so go ahead and blow into this because we are going to see if the medication worked for you or not. Okay. So we got up to 300 for your first one. Okay, gonna reset that and go ahead again. I got 305. Okay, try one more time. I'm gonna go ahead and reset that for you. Okay, so for this one we got 320. Okay, so reset this. Okay, so now we're gonna see if the medication works. So we're gonna take pre, which is your best of the one before the medication, 255 minus the 320, which is your best, over your pre, 255, then multiply that by 100. Okay, so this is over here. So 255 minus 320 equals 65 divided by 255, and then times 100. So you're at 25% of an increase, so which is good. This means that the medication of the albuterol helped with the meter dose inhaler. As long as there's between a 15 to 20% improvement, then that means that the medication works. So we're gonna continue with this. And then I'm also gonna do your vitals, just to make sure that everything is okay. I'm gonna do your pulse, your respiration, and your O2. How do you feel about your breathing right now?
Okay.
Better? Do you feel like you have any hard time breathing by any chance?
No.
No?
No hard time.
Okay, so go ahead and place this on your finger. I'm gonna take your pulse again for at least 30 seconds, and then your respiration for another 30. Okay, so for your pulse, I got 45, multiply that by 2, it's 90. Go ahead, double check that. And for your respirations, I did get 8. So multiply that by 2 again and get 16 to fulfill this full minute. So 16, pulse was 90, and then your O2 on here is going to be 99. And you said 0 for the dyspnea. Okay, I'm going to double check your skin just to make sure that it's good. No cyanosis, and then I'm also going to listen to your lungs. Is that okay?
Mm-hmm.
Okay, awesome. And then if for any reason you feel like lightheaded or just uncomfortable, just let me know and can take a little break, okay?
Okay.
Go ahead. Okay. I'm going to do the sides. You're still doing okay?
Yeah.
Okay. Okay, go ahead. Okay. Okay. And one more. Go ahead. Okay. How are you feeling?
Good.
Okay, so we're going to do the front now. Doing 8 or more again. Okay. Go ahead. And again. And again. Okay. 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 Okay, get 2 more on the front. One right here. Go ahead. Okay, go ahead. And then one more on your neck. Awesome. So your airways did clear up from the albuterol treatment, so that is very good. May I get you to cough as well, please? On the little napkin, just to see if there's any sputum. Okay, so no sputum, which is a good sign. And then she also has a gag reflex from the cough. Do you have any other questions for me by any chance? No? Okay. And then also, sometimes with a bronchodilator like albuterol, we would give a corticosteroid or any other type of steroid. If that was the case, you would probably wait a few minutes between the 2 medications, but after taking the corticosteroid or the steroid, we do recommend rinsing your mouth to prevent thrush.
Okay.
Okay, and then also for the care for the meter dose inhaler and your chamber, you could take the parts apart and you could either wash it and soak it in warm soapy water. You could always take everything apart, take this part off, take this part off as well. Soak them in warm soapy water and let it air dry. Same thing for this. You wouldn't wash your canister. You would just wash the actuator and the cap. And also, if you're going to be keeping this in your purse, just make sure that this is clear of any dust so that you don't inhale it. So air dry, no wiping, because if you wipe on the inside of the chamber, it will create static, and the medication, instead of being suspended in the air, it will cling to the sides and it won't be beneficial for you to be sucking it in. You'll just be sucking in air.
Okay.
Okay, So, any questions by any chance?
No, I think I got it.
Okay, so you're gonna be able to take all this home. I will be documenting what we did do today and our findings, and I'll report to your nurse and your doctor to see where we'll go from there, okay?
Okay.
So from here, I would deglove, sanitize my hands, and then sanitize my materials, like my pulse ox, I just put away. Sanitize and then put it away again. And then sanitize my stethoscope. Sanitize the bell and the earbuds. And then at this time, I will pass these. Thank my patient again. Sanitize. And that is it. Thank you.